Today the topic is the diabetes mellitus. It is a disease which is a group of the metabolic diseases which is characterized by the inappropriate hyperglycemia. What means by the diabetes mellitus? This disease, first of all, we will discuss about its definition. It's not a single disease, it's a group of the metabolic disease. Means that any defect in the metabolism is called as the diabetes. How this disease caused? It's caused by the hyperglycemia. What is the hyperglycemia? Hyperglycemia means in which the concentration of the glucose will be increased, due to which the defect in the insulin secretion. Means that it is a group of metabolic disease which is characterized by inappropriate hyperglycemia. As a result, there will be the defect in the insulin secretion, because as you know that insulin is used for the conversion of the glucose, and it maintains the concentration of the glucose. So any defect in this insulin secretion, it can cause the diabetes mellitus. And this defect can be occurred not only in the secretion as well as in the insulin action, or both. Now we will discuss some symptoms of the diabetes mellitus. First of all, if the disease is in the form of the acute hyperglycemia, what will be the effects? First of all, polyuria. Polyuria means more urination, means excessive urination. The concentration of the urine will be increased. And the polydipsia means the excessive thirst, means the concentration of the thirst will be increased, as well as the polyphagia means excessive appetite. These three main symptoms of the diabetes mellitus. The next is the weight loss, blurred vision, fatigue, tiredness means headache, and poor wound healing. Means if any wound is here, it can be healed but in very slow speed. Okay, we have discussed about the acute polyglycemia. Now we will discuss about the polyhyperglycemia. If this is in the form of the chronic, what will be the effects? First of all, the damage and the potentially failure of the various organs. Which organs can be affected due to the diabetes mellitus? These are in eyes, heart, kidney, blood vessels, and the nerves. They all will be affected by the diabetes mellitus. There are the types of the diabetes mellitus. Number 1 is the type 1, number 2 type 2, gestational, and some other specific types. We will discuss all these types one by one. First of all, type 1. What is the type 1? And what are the causes of the type 1 diabetes mellitus? Type 1 diabetes mellitus, absolute insulin deficiency, means in which the concentration of the insulin will be decreased, and due to this decrease, the conversion of the glucose will be decreased, and the concentration of the glucose will be increased in the body. The second one is the autoimmune destruction of the beta cells of islets of the Langerhans. As you know, there are the cells which are called as the beta cells, which are present in the pancreas. As you know that pancreas is responsible for this purpose, and the pancreas contains these beta cells where the islets of Langerhans is present, and any destruction in the autoimmune system, it can cause the diabetes mellitus. The next one is the autoantibodies to glutamic acid decarboxylase. This is an enzyme, decarboxylase, glutamic decarboxylase, which will be convert this carboxyl. So what will happen? The pancreatic islets of beta cells and insulin, they will be affected, and that's why this cause as the type 1 diabetes mellitus. Okay, this type 1 TIDM means type 1 diabetes mellitus. This will be diagnosed at any age, but this age must be before 30 years. Means that this disease, type 1 disease, if any present in any patient, its mean is age must be before 30 years. Now there is the type 2 diabetes mellitus. What is the type 2 diabetes mellitus? T2DM. Type 2 diabetes mellitus, it is most common T2DM. This disease mostly happen over the age of the 30 years. However, it can become a more prominent diagnosis in the adolescents of certain ethnic origins, like specific in the African American. But T2DM mostly typically overweight or obese, means that this disease must be happen in those patients which are obese or overweighted. That's why, or the second one thing, the most common thing is that if there is a positive family history of diabetes, means if this disease mostly transfer from the parents. Positive family history. This positive family history related to the diabetes mellitus. Okay, and the next thing is that how the next one is the gestational diabetes mellitus. As you know that from the name you can understand as what is the gestational diabetes mellitus. This gestational diabetes mellitus is a condition when any woman is in the pregnancy condition, the elevated plasma glucose, means that in pregnant women the level of plasma glucose will be elevated. So it means it must be concerned to the pregnancy. The fourth one is the some specific types. What are the specific types? Some secondary diabetes occur when the diagnosis of the diabetes is the result of the such other disorders, means that sometimes there must be some other disorders, some other diseases like the Cushing syndrome, acromegaly, cystic fibrosis, Down syndrome, pancreatic disorders. These can be ultimately leads towards the diabetes mellitus, and this is recommended as the specific types of the diabetes mellitus. This is not under the heading of the type 2, because these are the separate and these are due to some other diseases. This happened due to some other diseases, so this is called as a specific types. If you like this video, please like and subscribe my channel. Thank you.